Hi, my name is Matt Kosterman. As of 2026, I'm a 56-year-old white guy who lives in Chicago, Illinois. Over the past 10 years, I've transformed my life from one of chronic pain, depression, and financial struggles to one of freedom, contentment, and prosperity. I mean, sure, I've been known to get a little down at times, but hey, what human design projector isn't? I started this podcast to share with the world some of the amazing humans that have assisted me in my journey. In this season, I'm talking with more people who practice so-called alternative healing modalities. Basically, this is most things outside of what we know in America as the medical industrial complex. Shit is messed up around here, what with all the conflicting incentives. So my overall intention with the permission slip is really just to introduce people to other ways of relieving their suffering beyond taking a pill for the rest of their life. Hi, this is Matt Kosterman. Welcome back to another episode of The Permission Slip. Today I am here with Katie Simons, who is coming to us from beautiful Santa Fe, New Mexico, where they're getting an early spring. Hey, Katie, welcome.
Hi, Matt. Thanks for having me.
Thanks for being here. This is great. I'm excited to dig in. Katie is a hypnotherapist, a coach, and a facilitator of medicine journeys, among other things. And she comes to us with a background, fully Western background as a doctor of pharmacy. She got her doctorate from the Idaho State University. So again, welcome, Katie, and just love to hear kind of your origin story and how you came, from the dark side.
It's the dark side. I guess I'll start.
Yeah.
Go ahead.
No, go ahead.
I'll start as far back as my father is a pharmacist. And so in high school, not really having any direction that was out to go further my education, there was a lot of encouragement to just go get my doctorate of pharmacy. So that's the path I started on. And I can't say that there was a lot of passion for it until my clinicals. And then I realized I really loved working in the clinical setting. So after school, I went and did a residency and then ended up working for the Veterans Affairs healthcare system for 10 years, mostly in internal medicine and then medication quality and safety, and then as the patient safety manager. So there was a few different hats that I wore throughout that career.
It's like the VA is like the 800-pound gorilla of healthcare.
Mm-hmm.
It's like
it is, and it's like the 800-pound gorilla of mental health care.
Yeah.
So even working in internal medicine and cardiology, there was always that aspect to things working with a veteran population. But I really loved it until I did it. The turning point was really COVID, and what that happened to the healthcare system, no matter what healthcare system you were in during that period of time it was so eye-opening. It was like the stress test that showed all the cracks in the system and exploited them all. And at the time, I was not working as a pharmacist anymore, but as a patient safety manager. And so all the process improvement for the whole healthcare system was kind of my baby. Okay. And was like... Go ahead.
Patient safety is around medicine interactions and
it's
treatment.
Like anything that goes wrong in the system. So
Okay.
It could be medication related, it could be surgery related, it could be infection related. It was a program set up to try to minimize harm that happens inside the system to patients, which, if patient harm is a very common thing because we're humans taking care of humans in a very complex system, and that patients are really vulnerable. And, there are studies out there that say that patient harm inside the system is actually like the third leading cause of death in the US healthcare system, which is kind of one of those like statistics that's like, ooh. And having been there and done that job, I can tell you that's true.
It's true.
Yes.
You also have, you have patients who most often have been trained to completely give their power over to another human in order to heal them, fix them.
Yeah, especially as veterans, because veterans have been taught to
they're taught to follow orders,
uphold hierarchy.
Yeah.
They to do what they're told.
Right.
And so inside a healthcare system with a team of doctors and, an attending and then residents and student doctors and your nurses and your pharmacists, you have a very clear hierarchy. So it was my job to look at all the things that would go wrong or could go wrong and try to shore up systems so that those things didn't go wrong. And it was a hard job because there's a lot of systems that don't talk well to each other inside of a hospital, which is odd because we have technology that would allow that.
But you have your silos, your silos and your,
Yep. Your silos and different software systems for different departments. And there's lots of like...
Yeah, probably old software.
Some of them.
Yeah.
Some of them for sure. But then COVID happened and it was like the entire healthcare system in the entire country forgot about everything except for COVID. And it was very strange. And it felt like everything that I was doing, it just like made me realize that everything I was doing was just a show for the numbers and for administration to feel like we were doing something positive. And then when the priority shifted to something else, it was like nothing that I'd done mattered, and nothing that all the staff that had been working on these projects mattered, and all of the changes we'd tried to put in place to help keep people safe inside a hospital system, it didn't matter anymore. And it was just so odd. It was
wow.
It's like one of those crazy making phenomenons where you're like, am I losing my mind?
Yeah,
Did everybody else lose their mind?
So you had done all this work pre-COVID. You were doing all this patient safety and all this, and then COVID just made it irrelevant.
Yep. The only thing that mattered was COVID numbers and hospital bed occupation, and it was just so strange. And at the time, I was going through my own personal, like a divorce, and moving through my own personal stuff. And it just led to a lot of burnout and realizing that I had been on a hamster wheel that I thought was progress when it came to the energy I was putting into something I really cared about as far as taking care of patients in a healthcare system. And I just had to step back and look at it and realize, this is not progress. This is simply a hamster wheel. So I stepped off of it with very little plan.
Yeah. Wow. That's amazing. Super brave.
Yeah. When I stepped off the hamster wheel, it was really a big moment of, okay, where do I put my energy and my knowledge base, like that I've accumulated over the last 15 years? And the one thing that made sense was psychedelics. I'd been a closeted psychedelic user since college, and it had really made a difference in my life. And so it was like, okay, this is a space I can get behind and try to figure out what the needs are and how I can best serve this space, because this is a space that makes change happen, real change.
And what was your initiation with psychedelics in college? Like recreational, mushrooms, kind of a...
Yeah, recreational. Yeah. My first psychedelics experience was a total epiphany on MDMA at a Phish show.
Oh, there you go.
Of just realizing that I could physically be this happy. And in my early 20s, that was like mind blowing to me that I had been living my life not happy, and I didn't even realize it.
And do you attribute that? I mean, was there childhood trauma, or was it just a normal childhood and you ended up in the matrix, basically?
I had a pretty normal childhood and I have great parents. I
So it wasn't that.
have a great relationship with them. I did grow up in a very religious household.
Okay.
And I do think that religious conditioning has its own flavor of trauma that comes with it, developmentally. When it's something that is all you know from the very, very early age. And so there was some unraveling of that to be done.
In terms of that God's not sitting up there on a bench in the cloud waiting for you to do good or do bad.
Yeah, and that there's the whole concept of right and wrong, and being a good girl, and a lot of your soul is owned by something else other than you. That's an existential kind of aha moment that's kind of big to stumble into realizing it's not true.
Yeah.
But yeah, I would say no, I don't have any like major traumas, and I had a normal childhood, and I still ended up a really angry person when in my younger years. So yeah.
Maybe the said soul was trying to send a message.
Yeah. Yep.
Yeah. So the MDMA was the gate, the door opener. I mean, amazing then that you continued through the system, like working in the medical system and doing all the amazing stuff that you did in that box. Like, just I look at that and go, oh my God, that would be really hard for me to do.
Yeah, compartmentalization is a fascinating thing. And I can honestly say I lived two separate lives for a decade, easily or more, where it was like I was professional Dr. Katie Simons, and I went to work, and then I was the closeted psychonaut on the weekends, and going to Burning Man and Phish shows and exploring what consciousness was, but within the realm of what I considered reality at the time. And it wasn't until after leaving the healthcare system, that I think my little facade of what reality is kind of got blown to smithereens.
Crack that little sucker right open.
Yeah.
Well, did you not did you just at work not talk about like activities outside of work and what you were doing, or was you just basically wow, that's
correct. Yep.
Just completely like the old, I don't know if you're old enough to remember the old it was like Bugs Bunny cartoon with a sheep and a sheepdog and a wolf. And they would go punch in, they'd walk to work together and chat, and they'd punch in, and then the sheepdog would beat the shit out of the wolf all day, and then they'd punch out, and the wolf was all battered, and he'd be like, night Sam, night Bill.
Yeah.
I was like, wow.
Yeah.
Wow, since the 50s, the cartoon people have been trying to show us how this shit works.
Yep, exactly. Yeah. I think it wasn't until I sat with ayahuasca for the first time that it was like, very quickly, all of that conditioning, and I could see it for the first time, and really had to look at it and question my authenticity in what I was doing, and how I was living my life, and where I was putting my energy, and all the structures really fell down at that point.
And when was that? When did you first sit with Aya?
2022.
Okay, post-COVID. Nice. Okay.
Yeah. Yeah, and it was mushrooms had been my like teacher until that point, and it was a very clear like coming home in a lot of ways to start working with ayahuasca, and I jumped head first into that. Mostly not for any reason other than my own understanding of reality and myself.
And yourself. Yeah.
Yeah.
Let me just back up to the mushrooms for a minute, because I had a conversation with one of my clients when I was at photographing a meeting down in Florida last week. And I just want to try to dispel this notion that they're dangerous.
Mm-hmm.
And to my knowledge, nobody in the history of the world has died from consuming psilocybin mushrooms.
Correct. Yeah.
There's like no overdose. I mean, you won't have fun
Yeah.
on a big dose,
True.
maybe.
True. Yes. Even the drug interactions that are out there with mushrooms, there's a sect of people out there who would like everyone to believe that there's danger in some of that. And
in the interactions, like with SSRIs and SNRIs.
And I still have yet to see data that shows that people have actually come to harm, even with drug interactions on board.
So you might not have a trip, or it might not be particularly enjoyable or whatever, but the odds the odds of permanent harm are very, very, very vanishingly low.
Yeah, most of the antidepressants and sleep aids and antipsychotics that work on serotonin really block the ability for psilocybin to work. And so you have a blunting effect. Mm-hmm. And that in and of itself can certainly cause some psychological damage if there's expectations for a certain experience that then doesn't happen. Yeah. And having to unpack that. But the idea that people are dying or being hospitalized for serotonin syndrome is just not something I've seen substantiated. And it's certainly not been my experience in working with people who are on these medications with psilocybin, either through microdosing or with journey dosing.
Yeah. I mean, go ahead.
And so I don't understand why the fear mongering is happening I don't understand it.
I mean,
personally,
it's also more rightfully so in the MDMA space, which is also, for those of you, also known as Molly, or it's the active ingredient in ecstasy. But even there, and again, I'm not a doctor, I'm not a researcher, but it would seem, I mean, there's definitely a lot of caution in the medicine world about serving people MDMA who are on SSRIs. But there's also a whole bunch of people that go to parties and raves and they don't care what they're taking, and they take God knows what. And there's not like this massive wave of people with serotonin syndrome and deaths. And I mean, we would hear about it. I mean, that's because it would be giant news for any news company, agency to pick up on an adverse reaction from a psychedelic.
Yeah, with MDMA, it is interesting. Your interaction with SSRIs and SNRIs and other serotonergic medications is a little stronger pharmacologically in two ways. One, your blunting effect is more profound, and with MDMA, you do have a ceiling dose. So there is a point at which you get a toxic effect serotonergically, even with MDMA by itself, if you push the dose too high. So we can't, like with mushrooms, you can't just push the dose with MDMA.
Yeah, right.
So what you end up with for an experience is a blunted serotonergic effect, but you still get that norepinephrine and dopamine effect that MDMA has. And so you end up with a very distorted experience, for one. And two, MDMA, unlike psilocybin, does cause the release of serotonin in the brain. Psilocybin just stimulates the serotonin receptor. MDMA both stimulates the serotonin receptor and causes the release of serotonin. And so you do have a higher risk of serotonin toxicity, or what people call serotonin syndrome. And so for that reason, I usually don't recommend combining antidepressants with MDMA, simply because there is a slightly higher risk and you're not going to get the experience you want. So then it's the question of why are you doing it?
Yeah. And so talk to me about your guidance for somebody who comes to you, maybe, do you serve MDMA to people?
I will once in a while to
Okay.
certain people, but it's not my medicine of choice.
Sure. Yeah. And so what's your, because there are tons of people, I mean, I was on SSRIs for 15 years, but I was off them for probably, I don't know, 8 or 10 prior to any psychedelic use. But so for somebody who hears about, the power of psychedelics but they're scared, or they know that they shouldn't be mixing these, especially with MDMA. Although I personally like MDMA as an intro to psychedelics because it's a more embodied, non-ordinary consciousness. Walls are typically not melting. Things aren't, going super psychedelic. So how do you navigate with folks? What are some things for people to maybe be thinking about? Or, we chatted a little bit about microdosing.
I think this conversation really starts before the medicine of these are all tools in a toolbox, right? And so then the big question is, where are you now and where do you want to go? And that's how we pick the correct tool. When folks come and they're on an antidepressant already, the first question is, what's your relationship with this medication? How has it served you? Has it served you? Do you feel it has served you? How long have you been on it? Where are you at in this relationship with the substances you put in your body every day? And why are you now looking for another solution? A solution for what? And these questions are deeply personal and different for every individual. Sometimes the answer is, I've been on this medication 30 years. I don't know if it's doing anything for me anymore. I've tried to get off it twice, and that's been a horrible experience. But I would like to try life without it. And that's a very different starting point than someone who has been on it, a year and a half and was like, this actually really helped me cool down the symptoms that were making life completely intolerable. And now I'm looking for a little bit more. Or I'm still suffering from depression, anxiety. It may not be as bad, but it's still there. And so where we go from there and the tools we use are different. And I will say psychedelic medicine isn't always the first thing that I reach for. To me, in my experience with clients, step one is decompressing the nervous system. It's, can we get you into your body? And can we then allow a space where you can emote, where you can express your emotions, where you can feel your feelings? Sometimes that an antidepressant is actually blocking one's ability to do that. And so we need to kind of start taking that away in conjunction with adding some other tools. Sometimes people need the antidepressant in order to feel safe feeling their feelings, because if it's not there, they're too overwhelming. Antidepressants just turn the volume down on symptoms. And sometimes that's necessary and supportive, and sometimes it's blocking people's ability to move forward. And so where we go and the tools we pick depend on where a person's at.
And so that might be somatic work, that might be hypnotherapy, that might be a host of the things that you're trained in.
Personally, my go-to somatic tool is somatic breathwork, journeying. And I have found that is a really safe, contained, 1 hour long space that people can come to and breathe and get into an altered state of consciousness just through their breath, just enough for their body to have a space to scream and cry and kick and punch or just feel. what's coming up and then calm back down. It's a opening of a activation of your nervous system, and then a very intentional closing of it, so that your body starts to feel like, oh, I can do this, and I can do this safely. And that's been, I find it to be a really profound tool for people that's accessible no matter where they're at, usually.
No matter what medicines they might be taking. And when you say somatic breath work, so what does that look like? I've experienced a number of different modalities of breath work. Are you hands-on while they're breathing?
I do most of my sessions virtually. So
Okay.
no.
So no,
In person, it can be hands-on. But it's a structured 6, what am I looking for? What's the word I'm looking
cycles?
for? Of breathing.
Okay.
And the first 3 cycles are mouth breathing, so to activate your nervous system, to simulate a little bit more of a sympathetic nervous system response.
Got it.
And then the back 3 are nose breathing, to calm things back down and engage your parasympathetic nervous system. And in between, there's breath holds that are intended to kind of just bring you back into your body and quiet. So it's different from some of the more psychedelic breathwork modalities, because the intention is to get you in your body, feeling your feelings, letting them move through you, as opposed to journeying elsewhere.
Got it. Yes. I mean, as I've done this work, I've become so present to how the system it cuts us off from our feelings. Like we're told that they're bad. That I mean, from growing up, it was, stop crying or I'll give you something to cry about. So it started very early.
Yeah.
And then that just keeps getting reinforced. Boys don't
There's
cry.
no space for
girls,
them.
Right. Girls can't be angry.
Yeah. And what ends up happening in one's nervous system when we can't complete these nervous system activations through emotion, through letting that energy flow through us, is we end up in these states of freeze, chronic freeze, of dissociation, and of nervous system collapse. And that's not, when our body is like that all the time, we can't function.
No. Yeah. I mean,
we don't function very well.
I was in a state of, they never called it fibromyalgia, but it was damn near. I mean, I was so locked up and barely moved. Pelvis was just a brick, the whole thing. And it was working, especially with MDMA, that just showed me how all of that stuff had been stuffed. It was just, I was like, and I used to chew gum like crazy. And that was like just grinding the anger down, right? It was just giving me away, just grinding it. And,
and I think that the mental health symptoms that we see today in depression, anxiety, even as far as like OCD and ADHD, you're just seeing different expressions of this nervous system state of being. And some people's bodies express it in physical pain or insomnia or mental health symptoms. It's like, I think a lot of what we suffer from culturally really can be narrowed back down to what state is your nervous system in?
It's interesting. It's like they're all different expressions of the restriction on expression. Because it's coming out somehow. The energy's in there, and it's going to manifest it in some way. And
when we get contracted like that, we get so scared of feeling the hard feelings.
And that's and then the way the Western model approaches that is, let's find some substance that will make you not feel.
Which is exactly why reaching for psychedelics isn't always my first tool, because our mentality is cultural that way. And we see psychedelics the way we see pharmaceuticals, as something to reach for to make me feel better. And that is not the power behind psychedelic use. It really isn't.
Yeah. Talk to me about what is.
Psychedelics, well, there's a couple different levels to this. So I'll start with like the scientific one. The default mode network is this system of how our brain kind of runs through its normal processing. It's
day-to-day reality. It's what life looks like.
Mm-hmm. And it's our automatic thought processes, and they just go. And, those are built early in life, and they're kind of like a trench where you just run through them and they get deeper and deeper and deeper and deeper. And psychedelics disrupt those thought processes, that way of thinking, the way of seeing the world. And in doing so, they open a door to being able to see other versions of what's going on, other ways of thinking, other ways of experiencing. And that power is, I think, incredibly useful when it comes to changing what we believe and how we see the world and ourselves. They don't replace the belief system, though. They show
you that it exists.
Mm-hmm, exactly. And so there's still like all this work that has to be done. Once the chain's broken, it's like the analogy of being chained to a wall in a cave. Mm-hmm. And all this conditioning, whether it's generational conditioning or conditioning from your life or trauma, or, if you believe in past lives and reincarnation and karma, whatever it is, it's chaining you to this wall inside a cave. And when we talk about healing, these tools help us break the chains. But we still have to get from the wall of the cave to the door of the cave. And then when we have to step outside the cave, and there's a then what? There's a what next? It's like healing has a finite window. I really dislike when people are like, well, the work never ends. It's like, well, healing work has an end to it, yes. Mm-hmm. And then and what you get at that point is freedom. And freedom it's a really exciting thing, but it has this radical responsibility that comes with it. Of who am I and how am I showing up in the world, and what is authenticity, and what are the choices that I'm making, and
how are they serving me?
Exactly. And the only person responsible for that is now you. You can't any longer look at the conditioning. And so it's I think these tools help us break the chains. They help us move to the edge of the cave, maybe at a different rate than some of the older tools like meditation may have. They're still simply tools.
They're still tools. Yeah, I know in, Osho was an arguably an enlightened being. I mean, he argued that the traditional old form of silent meditation no longer really works in the society that we have created today. You need to do so. There's active meditations, there's crazy dancing meditations, there's twirling like the dervishes, and there's mm-hmm. things to break you out of your default mode network effectively. Mm-hmm. But no, having sat, I sat a 10-day silent meditation retreat, and it was beautiful. It was also very, very challenging, mm-hmm. To physically challenging to do that mm-hmm. For 10 days. But it was great, and it was a great prep work for psychedelic work. The backside of the mushroom trip was like, well, that's that same place I got after 10 days of sitting in silence.
Yes, exactly. It's the same place, different tool, right?
Yeah, different tool.
And I would say that no matter what tool you're using, if you don't have a daily practice of meditation, you are not supporting change for yourself. You're not supporting healing. And it's the thing that for all of us is the hardest to do for some reason, to just make the time and the space to sit. But over and over and over again, I tell people, like, you have to have a practice that's like brushing your teeth.
I'm guilty
if you don't
of that.
do it.
Yeah. It's interesting in my own experience. I was being very good about it last year for several months, and it I don't know if it's an excuse. I have a crazy travel schedule, and so that is I find it very difficult to maintain the practice. But there was also a level. I don't know if you've come up against this where things were really good,
Mm.
right? And I was eating well, and I was tuned in, and I was meditating, and there's a part of me that's like, oh fuck no. There's an addiction to the suffering. There's like,
Mhm.
it's
Yeah.
got to be hard.
Is it like a level of boredom that
Yeah, it was
comes up?
boredom, and it's also part of it also honestly is relating with other people.
Mm-hmm. Yeah.
It's a lot.
Yeah.
Like the world is a lot, you know,
The world is a lot.
and
Yeah.
it's almost, I'm working through this right now of like, okay, so we're doing some numbing, we're smoking some weed, and we're not eating well, and we're not meditating. Like, well, this kind of sucks too.
Yeah. Yeah. Healing work can get very lonely at some point
Yeah,
because when things are good, it's not always relatable.
it's not. Yeah,
It's not
and
always relatable.
it's all, and I also say this. I think the shadow side of it, for me is kind of being known as a guy who does all this healing work, and I've done a lot of retreats, and and I've transformed my life remarkably. I mean, incredibly, which I often forget just where I came from in it. But the shadow is this inability to say that I'm depressed. I don't really feel great. It's like a pressure to be on, a pressure to be healed, to be
Yeah.
great, to be right.
Yeah. Yeah. It goes back to like, what is the definition of being healed? And I
Yeah.
think you would get a very different definition from everyone you ask. A very shortened definition that I tend to use in my mind is access to choice. It's
Mhm.
freedom. And that doesn't mean that hard things aren't hard. And it means that when hard things are hard, I have the capacity to feel them, to move through them, and I still have access to choice of what authentically aligns with my passion and my values, even when shit is shitty.
Because shit's going to be shitty.
Yeah. This is the human experience.
No matter how much ayahuasca you drink, or
Correct.
toad poison you smoke, or
Correct.
Yeah.
Yeah. Yeah. But how do I show up as me, aligned with me, and taking care of me, and that gives me access to peace and to authentic connection and to my freedom and the things that I value.
Yeah.
It doesn't mean things are always good.
I mean, yeah, you're floating on a cloud down the street all day, and people throwing rose petals at you, and
Yeah.
yeah,
That I don't even know if that would be nice.
but whatever the definition is of healed, right? Or even just having, let's just say all of a sudden some relative I didn't know exists dies, and I have unlimited funds. Okay, but I still got to show up every day. That's why so many people who win the lottery, nothing changes in their life.
Yeah. Yep.
So along the lines of, working with somebody, we talked a little bit about this in the pre-call, in this finding somebody who facilitates medicine journeys. What are what are pros and cons? What are you looking for if you're going to go do a journey someplace? Let's say you want to find a new place if you're guiding somebody into finding a provider. We talked a little bit about solo journeys, journeying with medicine by yourself, which have been the vast majority of my journeys, have been on my own, mostly with mushrooms and MDMA, a little bit of acid. No, it's not my thing. Some ketamine, but a lot of people, again, automatically ascribe, well, there's an expert, there's somebody who knows how to do, I need to go find an expert, right?
Yeah.
What are some sort of harm, you come from a harm reduction background. What sort of things are you looking for as red flags in the space for people,
For facilitators?
for people, yeah, for somebody seeking a facilitator?
Oh, I feel like that is a big question.
Okay.
Because, well, one, I do think that people should feel more empowered to explore on their own and know how to create safety in doing so, as far as making sure that they're not on meds that are going to interact. They know what their source is. They know what their dose is based on that source. They know who their safety nets are if things do go sideways, and who those people are, and those people know what they're partaking in. And so I do think that there should be a little bit more spoken about in the space of like, feel empowered to explore these places on your own with the correct safety nets.
Yeah.
So that's one. And obviously that depends on the medicine you're working with. And then if you want to work with someone, I think getting to know that person and their ethos is important. How do they work? What's their background? How much personal experience do they have with the medicine they're serving? Does their sense of spirituality, because that will come into these conversations, align with you? And so I think that is a very personal thing. And so I encourage people to interview people, talk to them. Do you like this person? Do you feel safe with this person? Does this person seem to have a sense of what they're doing? Do they work alone? Do they work in groups? That matters depending on the medicine that you are working with. Like, and when it comes to training, that also is like one of those, in the Western world, we're like, where did you go to school for this thing?
What are all the things on your wall, right? What are all the certificates? Yeah.
And I can tell you straight up that there's a lot of training programs in the psychedelic space right now that, your requirements are to have 2 journeys.
Yep.
Okay. To me, that is not who I want to be sitting with.
Back to just for a second, harm reduction on the solo journey. Because again, that was, I mean, my initial thing with somebody was, my brother was trying to get me he thought these things would be helpful. And I was completely programmed like they're dangerous and they'll melt your brain. And ended up getting some mushrooms from him and kind of titrated. The first time was, half a gram. And then I went to a gram, and then that got interesting. And then I went to a gram and a half, and then it got really interesting. And then ended up doing MDMA with a therapist, but then reverted to then finding MDMA and working with that on my own and just, going in. But, and I got I just want people to know, there's test kits, there's dancesafe.org, I believe it is.
Yep.
If you're in the Chicago area, there's the Chicago Recovery Alliance, which has a van that is parked. It's one of 4 or 5 different places throughout the week, and you can take any substance to them, put it in a baggie, give them their phone number. They will put it in a mass spectrometer, and they will tell you exactly what is in that substance. If you want.
That's really cool.
Yeah. And they want people to bring them stuff because their funding is contingent upon them doing these tests. They're doing needle exchanges, they're helping, severe addicts, but they're also there. There's also, I think it's a company, is it Kikanos in Spain maybe, where you can send stuff off. I guess my overarching point is if you're new to this world, there are lots and lots of resources available for testing. There's fentanyl strips that you can easily get from DanceSafe, and you can test your material with that. And then you can talk to somebody like Katie about any interactions that might be present with medications that you're already on.
Yep. Yeah. That's kind of where I started in this world, was just offering that as a place that I could put my knowledge base to support the space, because I think it's important and it's needed for people to be taking that responsibility of like, okay, I want to do this thing. How do I do it safely? And simple drug interactions is just one of those things. As is like,
right.
Other like, what's your blood pressure, things like that, like the very basics of like, is your body going to be able to tolerate what you want to do to it?
Yeah. And then do you have like you said, do you have a safety net? Somebody know what you're doing?
Yeah.
And I would also highly advocate for completely clearing your schedule the next day. Don't.
Yes. Yes.
Don't,
Yes.
because you just never know what the backside's going to be like.
Yeah. Yeah. And that brings up like this big word, integration, that we harp on and harp on and harp on in this space. And to me, if you are going into a journey with an intention, which I highly suggest that you do, because I think our intention is what drives everything about these experiences, not our desires. There's a difference between expectation and desires and intention. But there's always an unpacking. What was that experience and what am I taking from it? How has it changed me? Has it changed me? Did I get a big download, or did I have just some somatic sensations come up, but then things shift a little bit afterwards? Like there's so many different experiences that come from working with these substances based on the person and the substance and set and setting and all of the other things. And so integrating is, okay, how do I take what the experience I just had and allow it to be meaningful in my experience of life moving forward?
And how am I going to show up differently as a result of what I was shown in that journey? And the other piece of during the journey that I tell people is, whatever comes up, don't resist it, because that is where things are more likely to take a left turn.
Yeah. Well, when we resist things, we suffer. That's true in everyday life. And it's even more true in the journeying space.
Yeah. In the non-ordinary space. Yeah. If you push against that, it's going to push back real hard. And just, it's nice to have somebody that you can call if you get stuck, and just to be, remind you it's going to end. It's going to be over. So anyway, I just wanted to kind of, because I love this. I haven't talked about it to this depth in previous podcasts. I just think it's important, like we talked about before the recording, is like, you're your own healer.
Yeah, absolutely.
This is about taking your power back. Certainly if you break your arm, doctors are very useful. If you need stitches, if there's, super complicated things. But, I've done, dozens and dozens of trips where I just put on some headphones, set an intention, drop some mushrooms, and see what comes up.
Yep.
And sometimes it's just the body needs to move, it needs to shake. I needed to see something, at that time.
Yeah. Yep.
And then when you are, and this is, I think, where did this come up on the boards? Going back to working with a facilitator. Oh, I know it's in Paul Selig's work, in the guides, their recent reading, and this showed up somewhere else. This whole game is ultimately about the collective. And so there is great power in working solo with a guide, and in a group, as is often done with ayahuasca. So maybe you can talk to to talk to that, that.
Yeah. Yeah. Ayahuasca is a medicine that I wouldn't do alone, personally. It is done in ceremony and in groups, and the people serving the medicine, I think, do so in teams. It's a collective medicine, and the power behind a collective space is really fascinating. I had been working with psychedelics for a while. Before I went to ayahuasca, my first ayahuasca ceremonies, and I walked out of my fourth ceremony feeling like I had just accomplished 5 years of really intense therapy. And that's coming from someone who was, I was doing my work and using all these tools already. And it just, it blew everything that I had been doing completely out of the water.
Yeah.
And
I think the thing is, you were doing the therapy. I mean, because that often gets bandied about that. Oh, psychedelics are like doing 5 years of therapy or 10. It's if you've been doing the work.
Yeah. Yeah.
Generally speaking, going in cold without any kind of frame of reference, it can get a little overwhelming. But
it can. It is interesting watching people come into ceremony from different places because, like I said, this medicine has. I laugh because it's like, what is choice when it comes to a relationship with a medicine like this? It like walks into your life and it's like, okay, this is we have a relationship now, and that's what it's felt like with ayahuasca, and it's just continued to be a huge part of my life ever since. And watching people walk into ceremony from very different places, of having done the work for a long time, worked with a lot of psychedelics too. I've never touched a psychedelic in my life, but I feel ready for transformation. And, every single ceremony is different for every single individual. And I can tell you every single one of my 60 plus ceremonies have been completely different. And it does depend on the group, who's in the room and where we are, and who's leading the ceremony. I think it has so much more to do with it than, where your medicine came from and who prepared it and the water that was used in it. Like, all these things make a difference. Yeah. And I think that before I started working with ayahuasca, I would have looked at you and said, yeah, sure.
Yeah.
But I've experienced it. And it does all those things. Every single little factor makes a difference.
Do you always do the dieta beforehand? Which for the uninitiated, it's a very clean eating, like no salt, no meat, no sugar, no processed food.
Yeah.
Right?
Yeah. The teacher that I worked with had a fairly loose diet compared to some diets that you will see in the jungle, in that there were certain things he didn't require. We stopped, like caffeine. A lot of people require that you stop caffeine. So you will see different versions of diet leading up to ceremony. And it really makes you realize how much food and the things that you put in your mouth are medicine too. There's an awareness piece that I think is really powerful, especially for Americans, because there's just a lot of stuff we eat that's not garbage. Real food.
Yeah.
Yeah.
A lot of processed garbage.
And so I think that the opportunity there is very different for Americans coming into ceremony for the first time than it is someone who's, deep in the jungle and eating whole foods all the time and going into a month-long dieta of ayahuasca. So I do think you will see some variation there, and the value changes depending on where you are.
And where do you go to work with it generally? The same place each time, or you've been all over?
All over, mostly Costa Rica, but then a lot in the U.S. too. Okay.
Yeah. I think it's so interesting. I first had heard about ayahuasca. Again, it was my brother back probably 2010, and at the time I was deep into my shit. And I researched it, and it was, first of all, it was all the bad. Oh, it tastes terrible, and you're going to vomit, and you're going to have, profuse diarrhea. And I think it's so funny, these things that we throw up as objections, because those are all such minor parts of the experience. I don't know if if that was your experience as well. How do you?
It depends on the ceremony.
Yeah. So you don't.
There have been
always
ceremonies
purge.
where that. Yeah, I don't always purge, but there have been ceremonies where that is the all-encompassing thing of the ceremony, and I think it really goes back to healing is an initiation, and we live in a society that we don't have initiations anymore. We don't have initiations into adulthood or into motherhood or fatherhood or, these big transitions in life. They just happen. They happen because we all get older. But I think that the discomforts that come sometimes with ceremonies, like with medicines like ayahuasca, are an opportunity to sit with things that are challenging and realize how powerful we are, how much capacity we have, and that we don't need to be afraid of discomfort or challenge. And even saying that is going to turn some people off.
Yeah,
and that's okay.
Yeah.
But I think that there's a huge opportunity in that.
Yeah, no, I love that. Yeah, I love that about the initiation. I mean, I've harped on that. Like, the closest thing that's probably there in the religious traditions is like, a bar and bat mitzvah in the Jewish faith, a confirmation. But it's nothing like, they do with like Sundance and the Native American tribes and the indigenous people, what they do for their initiations. And it's a big, I mean, I remember my own, getting ready to go off to college. And it was just like, I came out of a movie and I was like sweating profusely and I couldn't figure out what was going on. And when I look back on it, I was terrified because it was just, you just sort of fell from childhood into teenagerhood into adulthood. And that's just how we've chosen to do things, especially in this country.
Mm-hmm. But you see people carrying around this backpack full of rocks that is their past and is conditioning, and it causes suffering. And it's taking the rocks out of the backpack does take work, and sometimes is very challenging and uncomfortable. And life is the real ceremony. Life will teach you things if you're paying attention and willing to do the hard thing that you may not want to do. And I think ceremony with medicine is simply a mirror of that. It's a place where you can, in a very consolidated and intense experience, look at all of that and then allow your body to process and purge what it needs to.
Yeah, that's beautiful. Yeah. So as the medicine journey as a sort of microcosmic journey of within life, as an initiation, as a showing you can do hard things. I mean, I think drinking the aya on the first night was tough, but drinking it on the second night was a whole lot tougher.
Yeah.
I remember looking at it going, oh, really? We're going to do this again? Oh, shit.
Yep. There are definitely lots of nights where I'm like, wow, I'm back here. I'm doing this again. Fascinating.
Fascinating.
Fascinating. But I do think that some of the shadow pieces of medicine work, especially that I've watched happen to people, is they get very attached to, may I even say addicted to, going to medicine to have an experience or to get an answer, and there's a failure to translate that into life. And it's like, if this and there that that's a very sticky place. It's a very sticky place.
Yeah, and I've definitely been guilty of that over the course of the last 8 years. I mean, it's an easy place to get to. You just think, oh, I'll just do another trip. We'll go see what happens with the MDMA, and you can kind of get the same answers.
You over and over and over
Over and
again.
over,
Why?
right.
Why are you back here? The answer
Right.
is the same.
That's the same. Yeah.
You can
Yeah.
choose to make a change in life, or
Right.
to not, or but at some point you have seen all the things that are holding you back,
Right.
and
Although
it's a
I think
decision.
yeah. And at some point, though, it feels to me like it becomes. I mean, going back to the very first thing you said about the nervous system regulation. Like there's a level of where the nervous system has to be on board.
Yes.
You can't. I mean, and I'm sort of running up against that in my own life these days. It's like there's some things that I want to do, and there's a story that it's got to be hard, and my nervous system is like, fuck, I don't want hard. You know.
Yep.
So there's work there, which I have planned around that to continue to, and it's like I don't know what I don't know. I just know that I know that there's more, to be had, and I'm like it doesn't have to be like a walk in the park, but I've done a lot of hard, and I've also been told like it doesn't have to be hard, but my body's like, no, it has to be hard. It's got to be hard, and I don't want hard. Fuck hard.
Yeah. Well, and that brings us back to subconscious work where, again, tools to access what's below the level of consciousness. Where does this belief come from that things have to be hard, and how that's holding your body back, because your body is wired as a mammal to say, we're not going to do that.
Yeah.
That's something to be scared of. And so having places and tools where you can access those subconscious layers is just as important in making change, because you can have an awareness and say like, oh, I need to do this, and then try to do it and try to do it and try to do it. You're just fighting yourself. But it's like at some point when you were 3, something happened, and that's been internalized into a belief system that's now telling your nervous system not to do that because it's not safe.
Right.
Yeah.
Yep. And it goes back to the whole, where did you study hypnotherapy? Through what?
HCH Institute out of the Bay Area, which I highly recommend to anyone who wants to do a transpersonal hypnotherapy program.
Okay, they do a good job, because I think it's Marissa Peer who does the RTT, and it's like the, there's the 3 or 4 sort of core beliefs. I'm not allowed. I'm not enough. I'm not loved. And I can trace it all back to that, but again, it's at the level of the body. And so, is this where something like hypnotherapy comes into play to rewire the subconscious beliefs?
Yeah, to reframe them. Yeah,
to reframe them.
And I think that it's a very powerful tool for that. And hypnotherapy kind of has this really large umbrella of all these techniques that can fall underneath that. But really, what you're doing, regardless of the methodology that, RTT, I think, is a little more structured with a lot of scripts. Whereas how I was trained is first step is internal resourcing. Who's driving your ship, and getting in touch with that piece of what I would call soul. Some people may call it future self. Some people may call it wise self or healed self. However you conceptualize that, there is a part of you that has the answers. It's not me who has the answers. And that's the whole point of hypnotherapy, is your exploration of yourself in a way where there's safety and enough questions to prompt a story to unravel, and at the level of lower brain waves. So we're getting out of beta cognitive brainwave thinking and into more of an alpha meditative or theta brainwave state, where it's like your imagination. It's more of like a dream state. And answers and insights come through, and sometimes there's emotional imprints from the past that we can then go back and reframe. We can go back and change the emotional imprint of a thing that happened, so that it doesn't have power over you anymore.
Yeah. And it's fascinating to me, the layers of this stuff, because I've been doing this like you for quite a while. And, and you get to this point where it's just like, oh, fuck, really? Like it's that thing again, but it's that thing in another way.
Yeah.
right,
peeling an
yeah,
onion.
yeah.
Hmm.
It's like, yeah, that, like Ram Dass calls them little schmoos, right? Yeah. It's like, oh, there's that little schmoo again.
Yeah.
And I think he famously said, he's, here he does this, done all of this work and India and Maharaji and all the psychedelics. And he said, I'm just as neurotic as when I started.
Mhm.
The neuroses are all still there.
Mhm.
I think it's like, I had this expectation that they would all be gone as well going into this, right? And
Yeah,
they just sort of have less power.
yeah, it's like you have a relationship with something that you can see, because now you can see it,
Yeah.
right? Now I can see my inner child or my inner teenager or my inner rebel, or however you conceptualize your parts.
Mhm.
Now I can see it, which means I can now have a relationship with it, which means I can recognize when it's at the surface and then say, what do you need? What do you need from me? And how do I fulfill my own need here and hold this part of myself so that I still have access to my choice? And it's not hijacking me to.
Yeah. Yeah. And it's really being able to slow things down.
Mhm.
And then it speeds up, right? I mean, initially it's like a really slowing it down, really tuning in. But you can't, in the face of everything that comes at you, you can't always be saying, okay, let's stop and talk to everybody. Okay. Is everybody here?
Yep, exactly. But you can recognize when you lost that, awareness and that access to choice. Oh, I did this thing automatically and what was that, and where does it come from? And that self-exploration has to take place retrospectively. This is how we learn. But the more we do it, the less it takes
Less we
over.
need to do it. And doing it with, loving kindness, and not doing it with that old voice that used to be, that old beating me up voice is very, very quiet by comparison.
Yeah.
Like, oh, you fucked up again. And that it's more to your point of, okay, oh, I did this thing. I said I wasn't going to do this thing.
Yeah.
Well, let's not do this thing.
Yeah.
Yeah.
What does that thing represent that I need? Because it's not the thing you did. It's not,
It's never the thing.
Something different.
Yeah.
And it can be, that need can be worked with.
Yeah. So it's never the need. That reminds me of this old video from the internet about this man and this woman, and she had a giant nail sticking out of the front of her forehead. And all the guy wanted to do was figure out how to get the nail out. And she's like, it's not about the nail. And the whole thing. He's like, but he's looking at it, and which brings me to the question: do you do work with couples at all? Are you?
I haven't outside of the ceremonial context.
Okay.
I'll do couples journeys, but with my partner.
Okay. Yeah.
Because I do think that when working with at least couples of the opposite gender, that having both the masculine and the feminine present is really important.
So you and your partner will do journeys for couples?
Mm-hmm. Yeah, we'll facilitate together.
Yeah. Yeah, to have the balance, the energy balance.
Because it's really nice when I get to hold the feminine, because I know that that's my role and what I do best, and allow him to hold the masculine energy. And so that's how we do that.
Beautiful.
Yeah.
Well, awesome. Amazing. This was such a great conversation.
Yeah.
I love all the little turns we take with it.
Yeah.
And
thank you very much.
Yeah. It'll be in the write-up, but I just want people to know how they can reach you. And the website is the Holistic Apothec. Apothec? How do you say it?
Apothec.
Apothec. So the Holistic, APOTHEC.com is how you can get a hold of Katie should you wish to explore this magical world even further.
Yeah, absolutely. We're all just walking this path together.
Yeah, we are. Well, thank you, Katie.
Thank you, Matt.
I will look forward to this airing.
Me too.
Right. Be well.
You too.